Hello, good afternoon, and thank you for joining us here at the Clinic for the Rehabilitation of Wildlife for another segment of Wildlife Wednesday. My name's Rachel, and today I'm going to be going down to Crow's Hospital to meet up with Dr. Sasha Troiano, one of Crow's veterinary interns, to discuss a recent gunshot wound case that came in Monday morning. Now, the patient that we're going to be examining through radiographs and observing wound treatment is on a Cooper's hawk.
Hi, I'm Dr. Sasha Troiano, and I'm one of the veterinary interns here at Crow. I'm going to talk to you about gunshot wounds today. So yesterday we had a Cooper's hawk come in with a wound over his pectoral muscles, and so we took x-rays or radiographs of him to see if there were any musculoskeletal abnormalities or fractures. And when we took those x-rays, we saw that he had pellets in him, which indicated that he was shot, and he also had a fracture of his right coracoid, which is one of the bones in his shoulder girdle. So when we get birds of prey or raptors in here, they can come in for a variety of reasons. Sometimes they have a systemic illness, sometimes they have trauma or other injuries. In this case, this Cooper's hawk had obvious evidence of trauma given the wound that we saw. And so whenever we have trauma cases, we like to perform full radiographs to see what else is going on. In this case, it was a gunshot wound, which happens, unfortunately, not infrequently. And we can see gunshot wounds in a variety of species, not just birds. We see it in our crows, in our raptors, we see it in mammals, we've seen it in bunnies and raccoons. So it occurs for a variety of species. And we hate seeing it, but that's why we take those radiographs too, so that we can document for sure that the animal was shot and we can report it to the appropriate authorities. And then when we have gunshot wounds, depending on the extent of the damage or where the wound is, dictates whether or not we can treat the animal and successfully rehabilitate them and release them. So with this Cooper's hawk that we got in yesterday, we're optimistic. So he does have that soft tissue wound where the bullet entered, and we can still see the bullets inside him. So there was no exit wound that we could find with him. And he does have a fracture of his coracoid, which is a releasable fracture if it heals correctly. So we manage the wound with normal wound management. So we cleaned it and we bandage it, and we'll do daily bandage changes until it starts to close on its own. And then with regards to that fracture, we place him in what we call a body wrap. So that holds his wing into his side so he's not moving, and so that fracture is not moving. And then hopefully over time that fracture will stabilize and heal. Once the wound is healed and the fracture is healed, then we'll move him outside to begin his rehabilitation and physical therapy so he can rebuild his muscle. And we'll make sure that he can fly very well and hunt. And at that point in time, hopefully he would be ready for release. So when bullets are still inside of the animal, in some cases we remove them, and in other cases we don't. And it depends a little bit on where the bullet is and how accessible it is. So if the bullet is more superficial, if we can feel it, if it seems like it's something that we could just make a little incision and remove, then oftentimes we'll do that. Or if the bullets are near a very important organ or something that we're worried it would shift and potentially cause more damage if we leave it in, then we'll remove them as well. In this case, it seems like it's kind of in the musculature in his shoulder girdle, and so it would be, we'd have to dig around to find it, and that could potentially cause more damage than just leaving it in, because the bullet is not in the joint or anything like that. So it's not immediately necessitating removal. Sometimes with bullet wounds, there's an entrance and an exit wound, and the bullet is no longer in the animal, so it's already removed itself, and then we don't have to worry about it. When they do stay in, the concerns are that they could shift, they could cause more damage, they could move into a joint if they're near a joint. Sometimes you can have infection, especially if they've gone through the lungs or the air sacs. Like in this case, because of where it was, there's concern for that. So we already have him on antibiotics preemptively to hopefully prevent any infection, but those are some of the sequelae we can see with bullets.
Thank you, Dr. Troiano, for sharing all of that wonderful information with our audience. Before we conclude this segment today, I do want to address a question that our team frequently gets here at Crow in regards to lead-related injuries as it pertains to lead poisoning. So lead poisoning is another type of issue that Crow deals with here with some of its patients, but usually that's going to be from a direct result of ingesting food that has poison in it when the lead becomes metabolized by the patient. In this particular instance, because the bullet wound is located in an area that the body will safely wall it off, the medical staff isn't indicating that a removal would be necessary. Now, certain types of bullet wounds that would be necessary for removal would be those that are more causing complications with a skeletal structure. So because of the location, our staff has decided to leave it where it is. And thanks again for tuning into this week's segment of Wildlife Wednesday. If you appreciated the educational content today, continue to follow us next week or click on the donate button above.